Licensed practical nursing program. 3 semesters for the students. They get a summer off. They also go to clinical sites where they'll get hands-on experience in a wide variety of settings.
I chose the LPN program here at Northern because the New Martinsville campus was accessible to me.
I'm a mom, I have children, so the schedule and the accessibility.
We've built a new state-of-the-art simulation lab, mannequins that simulate real-life healthcare problems so that the students get to practice a pediatric version who will have an asthma attack. Hands-on experience in a safe or controlled environment so they get an idea of what to expect.
We have a real-life simulation lab, so we can do any type of medical scenario that we need. We've just recently had one that had a heart attack, so as a class we were in there, got to witness a real-life heart attack that maybe we might not possibly see when we're in a clinical setting.
The class sizes are small. When you only have 10 or 15 students, they get more individualized attention. Being smaller class sizes really sets them up to succeed, not only to pass their boards, but to work in the real world as well.
Favorite part about the program has been that the classes are smaller and more personal.
Being smaller class sizes really sets them up to succeed, not only to pass their boards, but to work in the real world as well.
A lot of the equipment's new. It's been a better learning environment for me.
Students in the nursing and healthcare field have a multitude of opportunities, especially LPNs. They can be utilized in long-term care, like a nursing home, physicians' offices, and even some of our hospitals are hiring LPN externs on medical surgical units.
I actually have an externship at Wheeling Hospital in the emergency room. It's part of our preceptorship hours that we need for the program. So I should have a job waiting for me when we graduate.
I see myself back in pediatrics. Next semester we are actually learning maternal fetal. We have a clinical site in Wheeling. I think the knowledge there would be wonderful. I could advance towards maternal fetal when I graduate.
The LPN program at Northern, it's a good stepping stool to further healthcare education.
Keep working at it. It's hard work, but you have a job waiting for you at the end.
As a non-traditional older student, it was intimidating knowing that this program, statistically younger adults fresh out of school with a smaller class size, it makes us more family oriented, so that was a little easier as a non-traditional older student to navigate college life again after so many years. Just do it.